and action. Liz had a question about iodine reactions, and in some circles it can be called the Jod-based Dow reaction, or iodine toxicity, or thyrotoxicosis induced by iodine, or it can actually be a positive response like in an overactive thyroid and cause a downregulation called a Wolff-Chaikoff syndrome or Wolff-Chaikoff reaction. But forget the names. I think bottom line is if you understand what happens with iodine in your body, then you will understand what all those names mean. So I've drawn a thyroid cell. Thyroid cell, which is usually here, and it can also happen in some ovary and some other tissues, but thyroid cell is responsible. This thing is really awesome for taking in iodine and making 4 distinct types of thyroid hormone. So this is the bloodstream. This is where iodine comes in. Actually, iodine comes in your diet. Iodide comes in through the diet, gets absorbed through the gastrointestinal tract, floats around the bloodstream until it gets to those cells that need or produce the thyroid hormone. And as I mentioned, the thyroid's one, ovaries are another. That's why when I have patients with polycystic ovarian syndrome and I give them iodide for the thyroid, usually the cysts go away in the PCOS. Remarkable, isn't it? But or acne gets improved. So when you get it in through the bloodstream, it gets into the wall via transport mechanism, and you know that transport mechanism does require that you have, well, we'll get to that in a second. The transport gets the iodide into the cell. The iodide then goes into the nucleus. This is the cytoplasm. That's the cell body. And then the nucleus, or the brain of the cell, the iodide gets in through there. And in that area, the nucleus, peroxidase, thyroid peroxidase is an enzyme, cleaves and makes the iodine usable. It actually makes the iodide usable into iodine. Iodine then combines with this molecule here, thyroglobulin. In the cytoplasm you have thyroglobulin. It's a molecule that will be able to bind with iodine and make T1, T2, T3, and T4. And I put them here, mono, di, tri, and tetraiodo. So when this big old fat molecule is produced in the nucleus, it moves out into the cytoplasm again, and then it gets cleaved again. That molecule is essentially a transport, and when it gets exposed to more enzyme, it cleaves off the mono and the di thyroids, the T1 and T2 thyroids, that gets put back into circulation, and it lets go of the T3 and the T4 thyroids into the bloodstream to be utilized by the body, the hair, the fat cells, the heart, the mind. So that is essentially the way thyroid hormone is made. T2, T1, not so active. T3, T4, definitely super active. In fact, that's what, if you're on thyroid hormone, that's what thyroid hormone is. Synthroid's typically T4. Armor or nature thyroid's T3 and T4 combined. Cytomel is T3 by itself. So those are the usual ones that we have out there available in the pharmacy. What happens, I think, this is the theory, is that some people think that you have antibodies to thyroglobulin and thyroid peroxidase. Those are markers. If you have Hashimoto's thyroid disease or autoimmune disease, you'll have elevated antibodies. Usually those two are the most common ones. Microsomal antibodies sometimes is also high. But when you have those two, the theory for most endocrinologists is that you have inherited the gene that says you're supposed to make all those antibodies, and you're stuck because once those antibodies form, if you have an antibody to this enzyme, an antibody to this thyroglobulin, that antibody is going to float around the bloodstream, find out where all the thyroid peroxidase is, and ram into this cell and eat up and destroy thyroid peroxidase, and eat up and destroy thyroglobulin because the body's misinterpreting it. That's why it's called autoimmune. You're immune to yourself, autoimmune. And you're going to eat any cell that has this stuff and this stuff in it. And you essentially dissolve, over the course of several years, you dissolve your own thyroid, which you do need this to make thyroid hormone, but people that dissolve it and essentially turn this into a bunch of nodules and all fibrosed, those people will have the symptoms of underactive thyroid. First, it's overactive thyroid because the body's mounting a response to it, and the thyroid's fighting back by making more, trying to make more thyroid. hormone. And then after a while, the antibodies just kill so many cells that it just burns out and you're underactive. So you go from hyperactive, which is anxiety, oily hair, oily face, acne, massive weight loss, diarrhea, to underactive, which is depression, weight gain, hair loss, constipation. So it goes from both ends. But again, if you subscribe to the theory that the antibodies are the source, then you're stuck. Once you have a gene and the antibodies, then it's only a matter of time before it eats itself up. I like the concept, I think Brownstein mentioned this, I like the concept of thinking that the American diet is lacking iodine. Actually, the American diet's also lacking vitamin D, magnesium, B12, iron for women. American diet is terrible, but it's lacking a lot of things, and I think iodine's one of them. A lot of my endocrinologists that I use believe iodine's not necessary to be checked, and it is a tough thing to check. It's usually urine. There's a fancy way to do it and a standard way to do it, but again, unless you're taking fish, shellfish, iodinized salt, which most of us don't do salt anymore because of hypertension, or seaweed, and most of us don't do seaweed anymore because of Fukushima and the nuclear power plant meltdown, so all seaweed is irradiated, supposedly, then you don't have enough iodine. And definitely in the Midwest, we don't have enough iodine. On the coastal states, you probably have more iodine because of the fish population, or the fish diet, but I don't believe that we have enough, and I think when you do take iodine, then body's okay. And we'll get to that in a second. That's what we're talking about now. But when you don't have enough iodine, then this production line ceases, and the enzyme is still there. So what happens is you have a backup of the production line, because the brain will still say, hey, let's make some more thyroid here, because you're not getting enough of the end product. So when the brain says make more thyroid, the thyroid has no choice. It's going to try to make it, but it doesn't have any iodine. So it starts to make too much of the wrong thing. And if it makes too much and the production line gets backed up and it gets too full of these byproducts that are not containing the iodine or iodide, then the body starts to attack these enzymes, the thyroglobulin or the peroxidase, and it starts to make antibodies because you're backing up the cell. So it's kind of like congestive heart failure. If your heart doesn't work anymore, the pump slows down, you have a backup not only in the heart of blood, but also in the lungs, in the liver, in the legs. It backs up totally. So, and then you have all the side effects. Well, I think that's what I believe, that's why antibodies get produced, is because you're having a backup from lack of iodine. And we can prove that by giving people iodine. If I give people iodine and their symptoms improve, and I haven't touched them with a thyroid supplement, like Synthroid, Armor, Nature Thyroid, Levothyroid, Cytomel, and they only get better with iodine, then bingo! It's because the underactive thyroid is because you don't have enough iodine. Now, inherently, sometimes what happens is if this cell complex hasn't had enough iodine in a long time, and suddenly you introduce it, which is, the spoiler alert, this is what we're talking about. When you introduce iodine suddenly at 12.5 milligrams, whether it's iodoral or potassium iodide or Lugol solution, you're going to have this factory turn on massively fast. So I always tell my patients, watch out for the first 2 weeks because you might be a little overactive. That can be what the jod-based reaction is. You're a little hyperactive for a short time. You go from underactive or hypothyroid to hyperthyroid, overactive. But I think you'll accommodate after about 2 to 4 weeks if you can manifest. I've had some people get really weird after a couple days, and for that you might want to go Lugol solution, which I believe is about, last time I checked, 2% is 12.5 milligrams per 12 drops, which is like 1 drop a milligram. So you can start at say 3.3 drops equal to 3.125 for 2 weeks, and then work up to 6 drops, 6.25 for 2 weeks, and then get to 12.5 eventually. That way you're really going slow, so you can kind of work into this. You give the thyroid a little taste, a little more taste, and then it starts to go, and you don't have that big massive response. So that's the jod-based reaction. That's the reaction you can have with iodine. Also, if you switch brands, you shouldn't be switching brands. Once you find a good brand, you should stick with it. But sometimes you will Again, you have to watch out for the side effects from the first 2 weeks. If you're on a thyroid medicine and then you take this, you definitely will have a little bit of a hyperactive responsiveness for the first 2 weeks. That other possibility of the Wolff-Chaikoff reaction, it's kind of cool. It's when you have an overactive thyroid, this is a different picture, but if you have an overactive thyroid where it's just working and making too much, and you introduce a hit of iodine, the body will downregulate until the thyroid cell slow down. It'll sense the presence of way too much and it'll block any further iodine or decrease the iodine that's being absorbed through that potassium pump or that pump that we talked about. And it'll slow down the amount that's being produced. It's a kind of a positive effect for a hyperthyroid patient, overactive thyroid patient. I don't know that my endocrinologist will do anything for that. Well, in a way they do. Methimazole, or one of the medicines that we use to cool down hyperthyroidism, is just that. It's a little, it's based off of iodine, but I'm not going to talk about that. This is more for people with underactive thyroid. So that's it. That's the response I usually have to watch out for. As far as the spelling of those things, jod-based out, Wolff-Chaikoff, overactive, thyroid toxicity, iodine toxicity, thyroid, whatever it is, don't worry about the name. Just understand the concept. If you understand the concept, then you'll know what to watch out for as you're reintroducing iodine into your diet. Now, certainly when you take the iodine, as I explained in my video, DrRIc tutorial, iodine, thyroid, you need stuff to get it in. And you can't just expect iodine to get in. You have to have selenium, about 100 micrograms. You have to have vitamin C, about 3,000 milligrams, and you have to have BU2 and B3. Those are important as building blocks or cofactors to get the iodine into the cell from the bloodstream. So good question, Liz. Hopefully this gives you a little bit of insight as far as why we have to watch out, what happened last time, and what's not going to happen this time. So hopefully if we get this stuff in, thyroid will be working better. You'll be cruising along by the end of the summer. It should be really good.